Hi, I'm Murph Fuentes, representing Hank, and I'm here with the esteemed Dr. Burley, who wears multiple hats. We've got a clinically trained doctor in the house and also a minister. And on top of all that, leading the faith initiative for the HIV Vaccine Trials Network. Could you tell me a little bit more about that work?
Absolutely. First of all, thank you, Murph, for this opportunity to share in the important work that we're doing, especially at this time in our work and in our world.
Absolutely.
So, the HIV HVTN Faith Initiative is really born out of very successful work during our COVID-19 prevention network work around the COVID-19 vaccines. Um, when COVID hit, the network recognized that in order for us to deploy a safe and effective COVID-19 vaccine with rapid speed, there was going to have to be a mass education campaign. And that education had to prioritize communities of faith. And so we were very successful. We were able to reach over 2 million people in 2 years,
Wow.
mostly virtually.
Wow.
And we contribute significantly to the awareness around the COVID-19 vaccines that allow people to then be able to participate in it when it became available. And so, um, on the backs of that success, I proposed to Dr. Corey and at the time Dr. Stefan Wallace.
Yes.
What would it look like if we expanded the HIV Vaccine Trials Network faith initiative around HIV to involve more people, to involve more resources. At the time, the faith initiative was just one person, Reverend Edwin Sanders, who had been kind of this singular ambassador who was championing the work of the HVTN around the world, really, for almost a decade. And they said, okay, let's do it. And so we were able to expand the faith initiative to six geographically dispersed faith ambassadors who have expertise both in public health, but also in their respective faith traditions and practices. And they're situated in the major cities around the United States, in the southern region of the United States. And together, we host education and awareness events to bring faith communities information that they otherwise wouldn't have access to about the research and the development of a safe and efficacious vaccine.
So it sounds like you think faith and public health are pretty integral to each other.
Absolutely. And so, probably my life's work at this point is promoting faith as a social determinant of health. We talk a lot about social determinant of health in our respective work, and we narrow them down to community, access to education, access to healthcare, one's neighborhood and built environment. But we generally don't pull out faith when we mention that. And in my experience, faith really guides all of those other determinants. And so I absolutely believe that faith and public health have to be partners in order for us to be successful in the work that we do.
That's amazing. Last question. This is a big one.
Okay.
So I think right now, as we've talked about, times are tough, and people are losing faith in our government, in our social systems, in each other. What is one message that you could pass on for the researchers, for all the advocates, and most importantly, for the community to take home with them?
So you're absolutely right in that people are losing faith in the systems down here. But in my experience, people losing faith in this world doesn't necessarily mean that people have lost faith in God. And I find that really encouraging because I believe that God loves all of us and God believes in all of us, whether we believe in God and whoever you might believe God is or subscribe to. And that helps me push forward when the world around me fails. That, sometimes these systems, sometimes these people don't necessarily give me hope. But I truly believe that there is a higher power, that there is a higher entity that believes in me, even when I don't believe in them. And that's encouraging to me. I hope that it can be helpful for others who are really struggling with the situation because it's hard to find hope in today's time. And, a part of faith, I can't prove that there's a God. I can't prove that there's a higher power. But just believing that there is something else that's looking over me, that's watching over me, that protects me, helps to keep me going every day.
Well, I was going to say, even just being with you, this wonderful, warm aura, it's helping me get the faith back a little bit myself.
I'll
So
take it.
I appreciate it. Thank you so much for your time.
Thank you, Murph.
Thanks.